This 12-year-old patient was referred to us for endodontic treatment of tooth number 31. According to the patient and her mother, tooth hurt to everything. As you can see, there's a filling in the tooth. It looks like someone tried to do a vital pulp therapy on this tooth a few months before. And here's the date when we first saw this patient. And this is today's date, as you can see, about 5 months ago. So we discussed options with patient's mother. As I said, she is 12 years old, and discussed root canal, apexification versus extraction. Patient's mother said there's no way that she would have a permanent tooth extracted. So she wanted to do the root canal, apexification, and that's what we did. So take a look here. This was immediately after we had done the root canal. As you can see, the canals, the roots, they all had open apices. We couldn't use gutta percha, of course, so we did apexification, of course, and obturated all the canals with MTA. So this is all MTA here, MTA, MTA. All MTA, obturated all the canals with MTA on this little tiny 12-year-old with opening like this, and tooth number 31, which is the lower right second molar. And again, that was, as you can see, about 5 months ago. That's the date, and this is today's date. All right. This is another angulation. Again, you can see the open apices and apexification that was done with MTA. And again, here's the date, as you can see, about 5 months ago. So patient came in today for same exact tooth on the lower left side this time, tooth number 18. We took a couple of PAs of tooth number 31 to see how the tooth was doing, and take a look. Tooth is doing beautifully, look. There's actually maturation of the apices of the tooth, as you can see here. And here's the date, as you can see, today's date. And this is the date today, as you can see. So this would be 5 months post-op of the tooth. Tooth is in full function. Patient has 0 symptoms whatsoever. Mom was very happy that we were able to save the tooth, and patient gets to keep the tooth, versus some of you who recommend, oh, this tooth should have been extracted and number 32 should have been pulled forward orthodontically to replace it. It's such garbage that some of you guys believe in. Absolute garbage, absolute nonsense that you guys believe in. Extracting a tooth like this on a 12-year-old, traumatizing the poor 12-year-old, and extracting her permanent tooth at age 12, and hoping that tooth number 32 would develop properly, and then an orthodontist would spend months trying to pull it forward mesially and into place properly. So many variables, so many things can go wrong, so many things that can go wrong. And all the pain and suffering and the money that patient's parents would have to endure. And as you can see, a simple root canal apexification, we're able to save this tooth for this patient. And I believe this patient will keep this tooth in her mouth for many, many years to come. Many years to come. So extracting a permanent tooth on a child and hoping that you're just saying it. You read it somewhere that could be done. Someone did it on Instagram just for baits and clicks. And you thought that now every single second molar should be extracted and replaced with the wisdom tooth. It's just such a BS. And I hope I've shown you a few cases like this that I've done, and I hope that I was able to change your minds. Never ever extract a child's permanent tooth, hoping that you can't do it. As I said, you extract a tooth like this, and then now it's the problem of the orthodontist. Poor orthodontist now has to, not only the orthodontist, but the patient and the patient's parents now have to suffer the consequences of your lack of education. I don't have a better term, I'm sorry. For you not understanding what you're doing and what you're saying because you read it in an article somewhere, or you saw it, someone did it and posted it on Instagram, and now you think every single second molar, as soon as there is need for a root canal or what have you, it should be extracted and replaced with the wisdom tooth. I'm shaking my head if you can see me. All right, so 5 months post-op of tooth number 31. Patient's doing great. We're able to save her tooth, permanent tooth for her. As you can see, the roots are developing. That's the point of apexification. The roots continue to develop, and you can see that here. So 5 months post-op of tooth number 31. Again, here's the date. This is today's date. Patient has no symptoms. Tooth is in full function, and patient's mother both are very happy. 5 months post-op of tooth number 31.